Hi everyone, welcome to my presentation titled A Dual Sector Approach to Psychology Education, Integrating a Certificate for and Mental Health within an Undergraduate Psychology Program. I would like to begin with an acknowledgement of country. We respectfully acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land on which many of the Swinburne University campuses are located. So who am I and what am I doing? My name is Steve Groves. I am at the Swinburne University of Technology. I am a PhD candidate and a sessional tutor in the psychology space. My co-collaborators on this presentation and my supervision team are Dr. Jason Skews and Dr. Lisa Wise. This presentation is a debut for my thesis. And in a broad sense, we're exploring the benefits of combining a Cert 4 in mental health with a psychology undergraduate degree program. This is a two-study thesis by dissertation, mixed methods, largely qualitative, with some longitudinal elements. We're also looking at some variables like career outlook, interest in psychology, course evaluation, and perceived knowledge and skills. So I thought I'd begin with some tensions. So students often, not always, but often come in with a need for more practice-focused study. Prospective students in psychology often come in wanting to be practitioners, and we end up teaching them psychology. There's some evidence to show that there is a discrepancy here in terms of what students want and what we provide them. And that discrepancy is not small or something to be ignored. It does have negative impacts on students' engagement and even in some cases, retention of students throughout the course. Many students see psychology much more as a helping profession rather than as a science. And that perception and that difference in terms of what we offer them versus what they wanted can, again, as I said, result in some negative outcomes. There's also an issue around this fourth year bottleneck, so that's getting to honours. What happens to all those students who went in with this idea of going into psychology as a helping profession? We provide them psychology as a science, we teach them psychology, but they don't make it on and continue on to a fourth year program. What happens to those students? In terms of tensions from our academic staff, we need to maintain integrity in psychology. So even though our students might want to have psychology as practitioner-related skills, we need to teach them psychology first. The scientist practitioner model is really predicated on this idea that you can't practice without the evidence base behind it. So it's absolutely necessary that we teach them psychology. Psychology is also not just clinical psychology and mental health. We need to teach them a wide range of psychology, like the fundamentals of cognitive psychology, information processing, things about social psychology. It's not enough to just teach our students clinical psychology and mental health. In terms of government and industry university architectures that can cause some tensions, there's a very large push quite often for job-ready graduates. I would argue that we give our students valuable skills, but these might be less immediately obvious to these bodies. So for example, I'm a big proponent of the idea of psychological literacy. I find this incredibly valuable and useful, but it's not always easy to see, particularly when we're talking to governments, industry, and so on. There's also a need to address a missing middle outlined in mental health reports and commissions, and that is, broadly a growing need for more non-clinical roles in mental health, or an expansion in the middle in non-clinical settings. So the problem space here is not necessarily a new one. We need to connect undergraduates with skills and practice-focused learning and work opportunities earlier. Ideally, we want to do this without compromising the integrity of a psychology bachelor degree program as well. So what are we exploring? We're looking at a dual sector approach here. What do we mean by dual sector? Broadly, dual sector means a combining of or collaboration across education sectors. In this specific context, we're talking about integrating vocational education and training, so the VET sector, into university learning. Specifically, we were looking at the Certificate for and Mental Health, which is a 6-month full-time equivalent course. I've just got the course description here so you can get a bit of an idea of what the course would cover. So the main focus of this qualification is to provide students with knowledge and skills that they can use in non-clinical mental health contexts. We've got some context down here, and these cover the areas that they learn about in the subject. So trauma-informed care, crisis and risk management, support for alcohol and drug users, NDIS support as well as peer support worker roles. It's important to note that this course is delivered via a blended delivery model, and it includes live and interactive online tutorials, campus practicals, simulations with actors, and also industry placement. I'd like to provide a brief spotlight on simulations. As you'll see later in my presentation, the students highlight this as a real highlight of the course. The simulations involve trained actors, the actor's given a character. The students have a goal depending on the setting. So it might be to run like a suicide risk prevention check or something like that. They take turns practicing in small groups, and then they switch actors, and then they run an assessment and get feedback on that assessment. I'm talking today about the Cert 4 in Mental Health 6-week intensive that we offer at Swinburne. So this is a 6-week intensive version of the 6-month course that's integrated into the Swinburne University program for our psychology undergraduates. So it's something that they can take up as an optional addition. It's run by experienced mental health professionals, and it's condensed into 6 weeks over the winter break. So June and August, they can do it in any year as well. It also includes 40 hours of placement. This has been running for several years now, but it's starting to gain traction with our students. So more students seem to be taking this up. So over on the right here, I have a Venn diagram of overlapping, essentially presenting the argument here for a dual sector approach, combining knowledge and skills, in turn influencing attitudes, combining undergraduate studies with Cert 4 skills to lead to career outcomes and combining all three. So I argue that the undergraduate degree provides our students with the fundamentals of research, psychological theory, and psychological literacy. Those things are very useful and they do overlap with career. There are clear applications in many, in a wide range of careers here. The Cert 4 in mental health, though, provides skills and training to prepare them for work in mental health at an entry level in a more specific way. So you can see here, we've got practice in controlled environments, activities, training, and also an overlap here with career. We've got career learning and also placement. The idea here is that the Cert 4 and the undergraduate integrate in a way to help students see a clearer pathway leading to a more positive outlook and also leading to more direct career connections. Allowing students to see a clearer pathway into the wider mental health system architecture and potentially entering that workforce earlier or having an earlier relationship with their future career in mental health or a helping profession. In terms of value for students, I think this exposes students to a reality of mental health work much earlier, and I don't see that as a bad thing at all. I see that as a very strong positive for this. It provides students with what they want without necessarily compromising on what they need. So it provides them with those practical skills that they were interested in earlier. It also might decrease the stress of the fourth year bottleneck. Having students aware of what else is out there in terms of non-clinical roles or not going on to become a psychologist, it might help alleviate some of that stress knowing that there is places that they can end up after a third year program. This also might lead to an overall positive impact on student engagement. Having students a bit more connected to this mental health as caring professions and working in the mental health sector might actually help them see how psychology is a little bit more connected, and what they're learning in our undergraduate degrees is more connected with their future career prospects. In terms of value to psychology education, it combines what they want with what they need. So we're giving students what they want, which is more practical exercises, but we're not compromising by taking things out here. It also helps address some AQF and APAC issues surrounding fourth year bottlenecks. Now, specifically, APAC has listed the third year undergraduate program as part of a pre-professional competency package in a pathway to psychology. This works fine and makes sense in an APAC context, but it does leave some of our students who don't end up continuing on that pathway in an odd spot where they've gained these pre-professional competencies, but they don't necessarily have the skills to apply them. We're hoping that the Cert 4 can interact there so that students have those skills and they can apply what they've learned rather than just having a pre-professional competency without the actual skills to apply it. It doesn't cut content to make room, so we don't have to cut down. We still get to teach them psychology and we don't have to make space for this, as this is something that they do in their break. In terms of value to the community, it assists in mobilizing a psychology literate passionate cohort. Our students are passionate and we hope they come out with psychology literacy, but we're giving them the ability to apply this knowledge with some skills. We're teaching this cohort more contemporary approaches to mental health care. This is something that's coming out of my data. Students come out with a much more nuanced understanding of treatment, things like person-centered care and a whole person approach. It might also address the missing middle gap. So we need a lot more people, so our students might be able to fill this missing middle in non-clinical roles, either while they're continuing studying or as an early exit point through the program. In terms of challenges and barriers to success, this early entry to the workforce might lead to early exits of the degree. So far, my data doesn't seem to suggest that, and that doesn't seem to be the case. If anything, it tends to motivate students to continue. It gives students more work. So this is usually a break period that they'd have, and we're telling them to do a 6-week intensive course. We need to be careful about overloading students here. It's unclear whether this actually addresses a workforce gap. Because this is a relatively new program, not many of our students who have done the Cert 4 have actually completed their undergraduates yet. So there's some, but not that many. Those who have found work through placement and things like that. But we would need to do a much more longer term analysis of the outcomes, 1 year post-degree, 2 years post-degree, and so on. There's also some concerns with scalability. This might be something that works really well in small groups. Placement's easy to get for a smaller number, but scaling this up might become quite difficult. So what have we done so far? We've explored student experiences quite broadly with some qualitative interviews, semi-structured via Zoom. And this was on any student who had finished the course. They were all psych majors, and we're in the early stages of analysis of this data. Some key themes in terms of student experiences. Experiences tend to be overwhelmingly positive. Simulations with actors, as I mentioned earlier, are quite highly valued. The students find them scary, confronting, but generally of great value. It also tends to reinforce some of students' interests and career focus. So I've had a few students come out saying, it really confirmed that I want to, continue on to be a psychologist, or it's confirmed to me that I want to work in drug and alcohol rehabilitation. It's also allowed students to have some self-reflection on what they're good at, what they're interested in. It's also worth mentioning anecdotally that some of the students that I've spoken to have had placements work out and turn into a casual part-time position. And that seems to be the goal of some of the students as well, is to turn that placement into a more casual position so that they continue that work while they're studying their degree. It seems to have increased motivation for psychology in the psychology undergraduate courses as well in some students. As I was saying before, students reflecting, saying this is something that really confirmed that I want to become a psychologist, and it seems to have had a positive impact on their motivation returning to their course. Some barriers to success. The course might be a little bit too condensed or intense. Many students have mentioned that they weren't quite aware how intensive the course would be. Think about it, it's 6 months condensed into 6 weeks. They do a similar amount of coursework, so it is quite intense. There were also some COVID interruptions. Some of the simulation sessions, some students have struggled to find placement. It's important to note though that some of this learning was reclassified as essential on-campus learning for 2021. Also have students saying more students should be doing this. That sounds like a positive, but it's also, when mentioning this, they say things like, I only heard about it because of this particular thing that happened. And basically it led to the conclusion that there might need to be more clarity in advertising for something like this, as a lot of our students might not be doing it, not because they don't want to, but because they're not aware of it. What are we doing now? We're tracking the 2021 cohort through the June and August period in a mixed methods longitudinal study with a focus on expectations, experience, change, and integration. So far, we have qualitative interviews with 10 students, quantitative surveys with 24. It's a relatively small cohort. There was only about 40 students in the 2021 cohort. We're looking at variables like career outlook, interest in psychology, course evaluations. We're collecting 3 time points at the beginning, after coursework, and a 3-month follow-up. The 3-month follow-up relates to things like placement. We're in the middle of collecting data from time point 2 now. Conclusions so far, the dual sector approach appears to address some previously stated tensions. The immediate effects might be positive, but we're quite limited in information on the longer term benefits, as we haven't seen many of our students follow through, finish their degrees, and go out into the workforce yet. Scalability is also an important consideration. I'd just like to end on this. Our students often come in wanting to help people. You don't need to be a clinical psychologist or even a psychologist to help people. This dual sector approach could help a wider student base apply this knowledge, skills, and training to work in a wider mental health system architecture. Just before questions, I would like to thank the staff of the Cert 4 in mental health for all their assistance. And I would also like to thank the students who participated in my study.